show parents are divided on whether to vaccinate their younger children. About a third are eager to do it. Another third plan to wait a while, and the next third have no plans to vaccinate their child. The Fox Medical team's Beth Galvin spoke to the president of the American Academy of Pediatrics about the kids' vaccine.
Dr. Lee Savio-Beers is a pediatrician and a mother of two teenagers who have both been fully vaccinated. And she sat down to answer some common questions that parents may have about vaccinating younger children. Nearly 1 million kids, 5 through 11, have already had their first COVID-19 shot, according to U.S. health officials. And Dr. Lee Savio-Beers, president of the American Academy of Pediatrics, says this is a big moment for families.
First of all, I think we're just so grateful that we have a vaccine available for children ages 5 to 11. And I understand parents, of course, are going to have questions.
So Dr. Beers agreed to answer some of those questions, like, why should I vaccinate my child?
Even though children are less at risk for serious illness than adults, they still can get very, very sick. And in fact, COVID is one of the top 10 leading causes of death this year in children. So that's not insignificant.
But what about the speed with which the vaccine was developed? Was the vaccine rushed? Dr. Beers says while the mRNA COVID-19 vaccines are new, the technology behind them has been studied for decades.
The process of approval for the vaccine went through the exact same steps that every vaccine does. There were a lot of resources, and so they were able to kind of go a little faster through the paperwork kind of stuff, the administrative stuff, but there were no shortcuts taken in the scientific process.
Kids are getting a lower dose vaccine than teenagers or adults. So what are the side effects?
The most common side effects that we will see after the vaccine are some of the same things we see with all vaccines. So sore arm or achiness, fatigue, maybe a little bit of a low-grade fever. Those things tend to go away, within a couple of days.
And there have been rare reports of myocarditis and inflammation of the heart muscle, typically seen in younger men, most commonly after the second dose of the vaccine. So what about heart inflammation?
It can be a very, very mild thing, or it can be very serious. That when we see it after the vaccine, it is almost always very mild. Kids do, people get better pretty easily afterwards. We take it very seriously, but people do get better. The other really important thing to know that people don't realize is that you actually can get myocarditis after a COVID infection, and that happens much more commonly and can be much more serious.
And Dr. Beers says so far there have been no reports of heart inflammation in younger children who've received the Pfizer pediatric vaccine. She says if you still have questions, talk to your child's pediatrician or doctor, or go to the website vaccineanswers.org. For your Fox Medical team, I'm Beth Galvin.